In a time when there was little understanding about the underlying cause of disease, the 19th century was a vital time in the field of health education. Though the health education movement was really just getting started, many vital discoveries were made during this time. The average lifespan for a middle-class man was only 45 years, while a working-class man was not even expected to live half of that time. This gap in the expected lifespan was due to the fact the working class had poorer living conditions and were in more crowded areas, and less access to medical care. It was believed at the time that bad smells caused disease. This thought was encouraged by the fact that the poorer neighborhoods where the smell was worse, the people had more diseases. In 1854, cholera was proved by Dr. John Snow to be a waterborne disease and not in fact caused by bad smells. This is significant because of the realization that poor water conditions were affecting the health of the population. Though there were laws to help protect the people, many were overturned due to unpopularity. For example, in 1853, smallpox vaccinations were required by law. This was overturned in 1909. The 19th century was a time when many hospitals were founded and more research began to prove the cause of disease and help develop treatments. The increase in research would be the start to a health education movement that continues today. A book was published in 1852 by Sir John Pringle that helped people understand personal hygiene as well as sanitation in latrines and barracks. Basic understanding of personal hygiene is the cornerstone for personal health and prevention of further diseases spread in a population. In 1848, the Public Health Act was enacted in Great Britain that would help sanitary matters by the authorities. This would involve the local governments in the basic sanitation of the people and help reduce the spread of disease such as cholera and typhus. As we all know, Louis Pasteur developed the principle for immune-based vaccines. This would change the way we viewed disease prevention and how vaccines operated. Health education in the 19th century was focused on disproving myths and helping people understand basic sanitation. This century would be a turning point for the health education field.